Welcome to the weekly checkup on ReachMD, your source for the latest medical education, breaking news, and various editorial topics. I'm Dr. Matt Bernholtz. This week we take a look at an old drug with a new trick, focusing on the century-old drug methylene blue as a potential agent for improving memory. Methylene blue is normally used to manage methemoglobinemia, a condition causing insufficient oxygen delivery from blood to tissues. But a recent study published in the journal Radiology found that the drug also increases activity in the brain regions associated with both short-term memory and attention. The study was small, not intended to promote methylene blue as a new treatment for memory loss, but the findings, crossed with a minimal side effect profile at low doses, make it an attractive target for further study. To learn more about this developing story and other topics related to memory, visit reachmd.com/medical news or download the ReachMD app. July marks the start of a new chapter for all of those currently in medical training programs. And to honor this transition, ReachMD is hosting Medical Education Month. Stay up to date with our new Medical Education Month playlist on ReachMD. Here's Dr. John Russell to explain more.
Hello, I'm Dr. John Russell, here to talk to you a little bit about ReachMD's Medical Education Month. Summer may mean rest for the typical student, but for those in the healthcare profession, July marks the beginning of residency, overnight shifts in the hospitals, and new roles for clinicians and students. In a field where the learning never stops, it can all become a bit overwhelming. As a residency director myself, I understand the difficulties faced. For this reason, I've worked with ReachMD to introduce a new playlist for the month of July. It offers new perspectives to residents and physicians from all specialties. To learn more, head to www.reachmd.com/medical education.
After touring through our playlists and collecting some well-earned CME credit for your efforts, check out some of our popular series programs making the rounds this week. On the latest episode of SexMed with Dr. Michael Critchman, learn about how you can help your patients select appropriate contraceptive methods without sacrificing sexual health. From oral contraceptives to implants to surgical sterilization, this episode takes a unique sexual health perspective on determining the best choices. For this week's editorial segment, we're focusing on the complex problem of student loans. Certified financial planner Jim Hemphill describes top approaches for reducing and eliminating medical student loans, featured in this episode of the series Your Money, Your Life: Financial Advice for Physicians. Here's a preview.
We run a series of financial education workshops for young physicians under the ReachMD banner. After each workshop, no matter the subject, their number one question is always, how about my student loans? A very few are fortunate not to have loans. They have family who paid for their education. But much more typical is the young physician with $185,000 or more of student loans. And their question is, how can I get these loans to zero? It's a complex issue, but let's start by asking some simple questions. So here are the questions to ask yourself. How much do I owe? What kinds of loans do I have? Are they public loans or private? If they're public, are they direct or indirect federal loans? Who will I be working for? Is it going to be a for-profit practice? Will I have an independent practice? Or a nonprofit like a hospital? What is my income going to be once I start practice? Does income-driven repayment make sense for me? And of course, for residents and fellows, what is my income today?
For the rest of this episode, and others from Your Money, Your Life: Financial Advice for Physicians, head to reachmd.com/money. Download the mobile app or listen on any of our radio platforms. On behalf of all of us at ReachMD, thanks for joining us today and have a very happy 4th of July. I'm Dr. Matt Bernholtz, inviting you to be part of the knowledge.